Hello and welcome. Today, we're diving into a complex and challenging condition known as short bowel syndrome, or SBS. We'll explore what it is, what causes it, and how it's managed. Join us as we unravel the intricacies of this important digestive health topic. Short bowel syndrome isn't a disease that arises spontaneously. It's usually the result of surgical removal of a significant portion of the small intestine. This can be necessary due to various factors, including Crohn's disease, volvulus, a twisting of the intestines that cuts off blood supply, mesenteric ischemia, which is a blockage of blood flow to the intestines, tumors, or even birth defects. Sometimes the bowel might not be surgically removed, but it could be dysfunctional due to one of these underlying conditions. Now let's understand what happens inside the body when someone has SBS. The small intestine is the primary site for nutrient absorption. When a large part of it is missing or none functioning, the body struggles to absorb essential nutrients, vitamins, and minerals from food. This malabsorption leads to dehydration, malnutrition, and electrolyte imbalances. The remaining bowel tries to compensate, sometimes increasing its absorptive capacity over time. However, this adaptation isn't always sufficient to meet the body's needs. Moreover, rapid transit of food through the shortened bowel can further worsen malabsorption. Short bowel syndrome is a relatively rare condition. Precise figures are difficult to obtain, but it's estimated to affect a small percentage of the population, usually individuals who've undergone extensive bowel resection. It's more frequently seen in infants who've had surgery for conditions like necrotizing enterocolitis and adults with conditions requiring extensive bowel surgery. While not common, understanding SBS is crucial for effective management and improved quality of life for those affected. The signs and symptoms of short bowel syndrome can vary depending on the length and location of the remaining small intestine. Common symptoms include chronic diarrhea, which can be severe, abdominal pain and bloating, fatigue and weakness due to malnutrition, weight loss, and steatorrhea, which is the presence of excess fat in the stool. Dehydration is also a significant concern, along with symptoms related to specific nutrient deficiencies, such as muscle cramps from electrolyte imbalances or anemia from iron deficiency. Diagnosing short bowel syndrome involves a combination of medical history, physical examination, and diagnostic tests. Your doctor will carefully review your medical history, paying close attention to any previous bowel surgeries. They'll also perform a physical exam to assess your overall health. Diagnostic tests might include stool studies to evaluate fat malabsorption, blood tests to check for nutrient deficiencies and electrolyte imbalances, and imaging studies, such as X-rays or CT scans, to visualize the remaining bowel. In some cases, endoscopy or colonoscopy may be performed to directly examine the bowel lining. While SBS is primarily defined by the length and function of the remaining bowel, it can be further categorized based on the location of the resection. For instance, resection of the ileum, the last part of the small intestine, is particularly problematic due to its role in absorbing vitamin B12 and bile acids. The presence or absence of the colon also influences the type of SBS, as the colon plays a crucial role in water absorption. The treatment and management of short bowel syndrome focus on maximizing nutrient absorption and minimizing symptoms. This often involves a multidisciplinary approach. Dietary modifications are crucial, with frequent small meals, often low in simple sugars and high in complex carbohydrates, fats, and protein. Oral rehydration solutions are essential to combat dehydration. Vitamin and mineral supplementation is often necessary to address deficiencies. Medications, such as antidiarrheals, can help control diarrhea. In some cases, total parenteral nutrition, or TPN, which involves delivering nutrients directly into the bloodstream, may be required. Intestinal rehabilitation programs, which aim to improve the function of the remaining bowel, may also be beneficial. Another potential treatment option is intestinal transplantation, but it is reserved for severe cases. Unfortunately, short bowel syndrome is generally not preventable, as it often arises from unavoidable surgical procedures. However, careful management of underlying conditions, such as Crohn's disease, and minimizing the extent of bowel resection during surgery when possible can help reduce the risk of developing severe SBS. Early recognition and management of complications following bowel surgery are also crucial. The prognosis for individuals with short bowel syndrome varies depending on several factors, including the length and location of the remaining bowel, the presence of the colon, and the individual's overall health. With appropriate management, many individuals can adapt and achieve a reasonable quality of life. Research continues to advance our understanding of SBS, leading to improved treatment strategies. One exciting area of research is focused on developing therapies to stimulate intestinal adaptation and growth, potentially reducing the reliance on parenteral nutrition. Scientists are also investigating the role of the gut microbiome in SBS and exploring ways to manipulate it to improve nutrient absorption.